So I farm so hard, the employees wanna find me, and then wanna hire me. What's 100K to a guy like me? Could you please remind me? Farm so hard, this ain't easy. Working late nights, you best believe me. My grades can only go A's. Never wanna see another B unless I'm Jay-Z. Farm so hard, let's get paid.
What's good, fam? It's your host, Jimmy Pruitt, aka PharmD and ED, and I'm bringing you another episode of the Pharm So Hard Podcast. This is going to be a monumental episode. We're going to be doing something, and if you're currently listening to the Empower RX conference, you probably just found out that we have some big news for you. But I don't want to spoil it to you so much. If you guys haven't checked that out yet, we've been trying to stream it. We've been working very hard for the last few years, and we heard you loud and clear. We've heard every conference for the last few years that we deserve a little bit more. We deserve this moment for emergency medicine to really get to the next step. And today we finally have that moment, and I'm so excited to have been part of this, but all the mentorship, all of the people who's really poured into this monument has been phenomenal. And just a few hours ago at Empower RX, history was made with the launch of the Society of Emergency Medicine Pharmacists. This is going to be great because this is the first time we're going to be uniting ED pharmacists, EM pharmacists, not just academic pharmacists, not just pediatric pharmacists, and not even just EM pharmacists in the US. This is going to be something that's going to be phenomenal, an international society of all EM pharmacists coming together to do phenomenal things from research, from practice, from advocacy, and just pulling all of our resources and our focus together so that every day when you wake up, there's going to be somebody focused on the practice, the research, and the livelihood of emergency medicine pharmacists first. And that's what's going to be so phenomenal about this. And we're just so excited because we went through this. We went to places where we're just an add-on. We had a few presentations for us at certain conferences, or a particular group thought that it would be nice just to have us there. But this is the first time that it's going to be for us and by us. So let's dive a little deeper into this, because the biggest thing people would say is that we have all these other interest groups. Why now? And I think we have to go back and look at some of our history to understand where we are today. And if we go back, we have to realize that there's been rapid growth in the PGY2 EM programs when it comes to emergency medicine. In just 2007, I did an episode with Brian Hayes a while back. There were a total of 3 EM programs. Again, in the early 2000s, just this past match cycle, there's over 130 EM pharmacy residents that were the physicians were recruited for 114 programs. Again, this is something that's going to be great over a decade. The number that's out there, and we did the math, is that is 3,700% growth in emergency medicine pharmacy residencies since 2008, which is insane. It's just an insane number to think about. Also, we have to think about the fact that there's a new specialty credential. We have the BCEMP now. So we have that. We've been recognized as a specialty, and we know there's increasing evidence of pharmacists making impact. Again, whether it's talking about reduction in medication errors, ED lengths of stay, increasing patient outcomes, all of these things we know. And the thing that really gets people going, that wears the suits, is that there's been numerous studies published saying that cost savings exceed over $500,000 for pharmacists per year. And there's been some studies set up to $1 million. So that's gonna be one big thing. And then the component of that is seeing this growth, seeing all this, there's this such huge existing, again, being fragmented across the board. There's emergency medicine pharmacists scattered across interest groups and certain pharmacy organizations. There's some interest and making an interest group in physician organizations, but there are no standalone. There's no pooled sources that's focused solely and primarily and only for EM pharmacists. And that's something we had to think about. And this is why we're at 90 EM pharmacists in the one and only the largest going to be EM Pharmacy Society of Emergency Medicine Pharmacists. And we've been able to show through EmpowerRx, again, with this being the first conference gathering 4 years ago that attracted international attention. And we right now, while in the recording of this, we have international people coming from Australia, Canada, all over the world, physically to be there, but tuning in from every continent in the world. So that's something that lets us know that it's there. And there's a clear community message. We want a professional identity, not necessarily just an interest group. And we want to be part of something that where we can be able to get the resources for research and dive deeper in that outside of the traditional things we have. We want primarily being able to do that. And it's a few ways to look at this. But when we talk about the burst of SEMP, we have to look at it being grassroots nature. Again, it's informed by conversations and shared frustrations during conferences, doing conversations, and people have been reaching out for years asking when this is going to happen. And the cool part, this is going to be pharmacy-led. Again, clinically driven mission. Getting better the practice, better the livelihood of EM pharmacists when they're actually at work, looking at how we actually provide different avenues for burnout, because we're at the top in that. How do we figure those things out? That's something we want to look at. And I've been fortunate to be part of many things, but I will honestly say this is the most important piece of work that I've been part of creating. Being part of the founding process has been phenomenal. And it's been years to get here. And we've had some hiccups, guys. We had some hiccups. During the process of all of this, we've had times where we were ready to go and we had a group of core people ready to go. And this is going to be terribly expensive. This is going to be terribly time consuming. And things just didn't lead to where it needed to go years back. But thank God that we were able to get the core group of people together and get the right identity, the right messaging, and the right structure of how to do this nonprofit organization that's focused solely on emergency medicine pharmacists. And that's going to be great. Again, with the inaugural board being myself, Louisa Sullivan, some of those you've seen before, John Packa, based out of Grady Health System, over 20 years of clinical experience at the busiest trauma center in the U.S., depending on what year you look at, top 5, if you want to be very specific. So that's going to be representing the pharmacists that have a ton of experience in understanding how ASCP surveying work, understanding how PGY2 programs work. We have Louisa Sullivan, who is a monster when it comes to organization and creating things and maintaining things. She's going to be our president-elect right now. We have James Miracle, who's going to be representing Alabama and Birmingham, again, being a pharmacist that work in the community space, building a residency program that's super intelligent, phenomenal person, and really is a go-getter. And then we have Christopher Edwards. Again, all of you know him. He was fundamental in the creation and just really pushing through the board-certified emergency medicine pharmacist. He was, again, the top of the top. He really pushed through, and he's one of the most humble people you ever meet, but he brings up the academic side of this. There's some pharmacists that work primarily academic, very heavy in research. He's going to bring that piece to our board. Then we have Jamie Johnson from the toxicology side of things, bringing in a really good knowledge base, understanding the tox side. And we know that tox and ED run hand in hand, and all the ABETs out there have been doing a phenomenal job transitioning from the tox fellowships to being ED. So that's going to be our board, our inaugural board and leadership. Again, I'll be representing the president for the first year, and I'll be focused a lot more on the executive side. But I think the thing that we really want to talk about is what SEMP stands for. What's the mission? And we've thought about this a lot in our strategic planning meetings and really being able to focus on advancing emergency medicine pharmacy through advocacy, education, research, and global community. That's our mission statement. We really want to focus heavily on each component of that because I think it's so important that we are bringing all these pieces together. And we really have these pillars that we really want to focus on from a practice elevation side of things. We're all clinicians. We all practice right now. Being able to develop EM-specific clinical guidelines, position statements. These are things you want to do, being able to build toolkits and resources that are developed collaboratively by EM pharmacy experts across the board. So no matter what organization or where you come from, the focus of this is being able to bring this together. And then looking at my educational perspective and professional development, we're going to be doing something that's going to be really phenomenal. And we've spent a ton of work building this up. And we're going to be also launching something that's phenomenal, the Journal of Acute Care Pharmacotherapy. This is the first ever EM pharmacy journal that's going to be launching soon. Getting together our editorial board, getting together our first edition drafts and all the back end components. It's a ton that go into making an open access journal and really figuring out how to do it in a way that not only is exciting right now, but how is it going to be sustainable? That's something we're really going to be looking forward to doing. Again, we're going to be transitioning over now in the education space. The Empower RX conference will now be ran by the Society of Emergency Medicine Pharmacists. And this is going to be great for a multitude of reasons, because really that was the genesis of this, at the beginning of all these things, but it's going to add a new piece to it. And we're very excited to be able to transition the ownership management of this conference to the society. And it's going to be phenomenal to really figure out the things that we can do. Again, this is going to be the official meeting of the society. We're going to continue to provide specialized EM pharmacy CEs, but it's going to expand next year. And if you're wondering where it's going to be next year, we've already got that booked out. We're going to be in Orlando, Florida next year, April 9th through 11th. And it's going to be at the Doubletree by the airport. So it's going to be phenomenal to get in and out of Orlando, being able to be close to an highway that can get you from anywhere throughout. So that's a quick nugget for that. But along with the education, we're going to be providing regular webinars, virtual events, providing just ongoing learning opportunities. And from an advocacy standpoint, this is where the unity part comes together, putting aside all other differences and focusing on partnering with our EM physician colleagues, whether it's going to be ACEP, SEMP, working with SEMPA, or our nursing organizations to really focus on some unified policy statements and being focused on pharmacists' roles in the ED staffing model at the institutional and policy level. So I think of people like Ryan Feldman that worked on things about pharmacists getting the ability to administer medications and making it something that's foundational. I would love to see where that goes with additional support from pharmacy groups. What if there's a position statement on that? How can these things change your day-to-day practice? That's what we're going to be focusing on. Then the next part is going to be research and scholarship. That's a huge part of a lot of people's work. That's a great way to contribute to the society in itself. We're going to be coordination with multi-center EM pharmacy projects. We're going to be building a group especially for that. But the thing that really matters to me is being able to provide resources, providing grants and mentorship opportunities for EM pharmacy research, and then facilitating global research collaborations amongst EM pharmacy professionals. There's a ton of work going on in places like Australia. They're doing a phenomenal job out there. Dr. Roman and her crew. There's some people who's out in Germany that's doing some things. I've even had a few workshops and worked with some people in the West African region. So again, I think there's a lot of work that can be done to combine these efforts, and we look forward to that challenge. And then lastly, I think this really ties it together. It's going to be global unity and community. Again, having international representation and membership engagement, global advisory panels to address really region-specific EM pharmacy-based practices, and even looking at this from a different level, unifying the pediatric pharmacists across the pediatric emergency medicine pharmacists across the U.S. and across the world, unifying the community, the academic. This is going to be a big movement to get all those people together to working on things that really impact our patients, our livelihood, and our future. So you're wondering what's going to really differentiate this from other organizations? Again, unlike some of the other organizations that are doing a phenomenal job at what they're doing, SEMP exists purely to serve EM pharmacy without any dilution. There's no other focus other than advancing the practice of emergency medicine through the ways that we spoke of earlier. It is going to be clinician driven, like clinically driven and pharmacist led. We're going to have people who actually understand what you go through in the day-to-day, actually doing all of this work and having a team built by us and for us. That's the big mantra. And it being really pharmacy centric, not necessarily academic focus, not being a subgroup or anything else. This is going to really be solely for you if you want to come into this space. Great thing is that we've made sure we've written into our bylaws to allow for a student chapter. So if you know you want to get involved in this, and we've seen this rapid growth in emergency medicine, we'll have this pathway to allow people to really start early and understand what we need to do to be able to really engage in that. So we're super excited. I'm going to be basically donating my platforms to this. I'm going to just be pushing everything I can. So you're going to see a lot of this on the Pharm So Hard Podcast Network. You're going to see us transitioning over the conference from being ran by my nonprofit organization to being managed by the society. This is going to be really just being able to focus on using the tools that we have to really push this. And we're going to be focused on innovation as well. From a digital and global approach, we're really pushing a strong digital presence, a strong social media engagement. So if you're listening to this now, just type in EM Pharmacists on your major platform and we should be there. That's going to be our handle for everything EM Pharmacists, and even our website, empharmacist.org. So you can go there to find out more information. And I know a lot of information is coming at you at once. So it's not like we're not going to talk more about this. We're going to be scheduling a town hall within the next few months to really dive deeper into some of these things, because we've already planned out the next 3 years when it comes to the details, and we've already had some pathways out into 2030. So we're really focused on how to build this, not just for us, not just for my 1 year. It's really going to be figuring out how can someone like you who's listening to this right now, what's going to happen when you have the resources, you have the back end, you have an assistant that's ready to listen to what you need to get done to push things forward for our profession. So it's really going to be focused on you that's listening right now. So very excited about that. And I don't want to get too far involved, but I really want to get you guys some of the meat and potatoes of what we're looking at. For year one roadmap and achievements, the real big focus on me is we getting our official committees established, the membership committee, education and conference committee, research committee, advocacy committee, communication and media committee, and awards and recognition. The next step is going to be launching the Journal of Acute Care Pharmacotherapy. Again, this is going to be the official journal of the society, but the twist is this. We're actually going to be looking at this from a holistic approach because, again, unity and kind of grabbing all the pieces of emergency medicine is what we're going to be looking at. So we're not just going to focus solely on things that are written by EM pharmacists, but we're thinking about the drugs that are used in the ER. We're focusing on the drugs that are used in the acute care space. So whether you're infectious disease, we're going to have some focus on that. From a critical care perspective, we're going to have a focus on that. Toxicology, pre-hospital, pediatrics, the things that make up emergency medicine. The journal's going to be focused on that. Because I don't think that we can truly appreciate emergency medicine without understanding and appreciating all of the aspects of acute care pharmacotherapy, which make up ED. So it's something that we thought a ton about, from the naming to the platforms to how we're going to do certain papers. It's going to be phenomenal. And we're going to have some really cool, unique things that we're going to be able to allow people to publish that may not have been out there in the past. So we're going to dive deeper into those in some future episodes and some future town hall meetings that we'll have set up over the next few months. But this is really just to give you guys a clear understanding of what's happening and what is these next few steps. Again, hosting the inaugural SEMP branded EmpowerX conference in 2025 and 2026 in Orlando is going to be really big, and really getting the membership growth there. Again, I've always been focused on being able to provide a ton of value and do it at a price that's reasonable. Because again, it's not someone who is solely business that's at the top of this, that's running the organization. We have clinicians running this. So our pricing is going to be appropriate, as it's been for all the things I've been involved in. And we've really fought really hard to figure out a way to be able to provide resources, but not necessarily be an overpriced. Just really ask yourself why you're even being part of this. This is something that realistically, if you buy a cup of coffee every day, you should be fine with the membership pricing that we've established, and we're really proud of that. So we're going to be focused big on building our membership growth, getting the official founding members. So those of you who's listening, who wants to be part of this, this is going to be our first group. We're going to be honoring them at our conference next year, again, have the founding members, and we have a special piece of history for you. So there's no reason why you shouldn't jump on this, because again, the pricing is not going to be a limitation. Our focus and mission is not going to be a limitation. And really, this is going to be a big focus in pushing us forward as a whole and waking up every day and focusing solely on emergency medicine pharmacy. So that leads to the last thing I want to talk about. How can you get involved? The biggest question, all of them, you hear me talking about this may be exciting to some of you, and you want to figure out how to get involved. And there's a ton of different ways. I mentioned the first one being a founding member. Again, we have clearly defined membership tiers from a full membership, associate, our resident/trainee, and then our international, and some of our emeritus ones as well. So we have these different ways to get involved. And again, I'm proud of the pricing of that, and we'll make sure that you guys are taken care of. And we have some different options going to be available for us in the future to really make the pricing not an issue. The founding members, again, receive recognitions and special benefits. And the next part of what we're going to be looking for is volunteers and leadership opportunities. Being a participant of our committees, we've mentioned that, and applications for that is open now on our website. Or if you want to be more involved, and if you have 2 to 5 hours a month that you can spare during this initial time of growth, maybe being a chair or a vice chair that can be taken over in a little bit, those are things to really be involved in. Now, if you're more research focused, we have some editorial things that we can look for as well. We need some reviewers. We have a special program that we're going to be allowing people who need a little bit more mentorship to get part of a program where some of our senior editors can mentor them throughout the year and allow them to have a little bit of building up of their skill set to really grow. And this would be a huge CV adder. But we have different ways to get different people with, if you have a lot more time and numbers of experience, we can pair you with someone that may not necessarily have as much time, but have a ton of experience and really get heavily involved in the research side of this. And that's going to be great for the journal, because again, we're not limiting that just to ED pharmacists. That's going to be allowed for some other people who are in a critical care space that really tie nicely to what our mission is. For the journal, is going to be a little bit more broader of a profession, but for the actual society, it's going to be very detailed, and for as it being focused only on EM pharmacy. And then if you don't want to do any of that, or if you're super excited and you want to add on to that, spread the word. Send this podcast to someone, send some of the social media posts, follow our page and share our page. Use the hashtag SEMP or hashtag EM Pharm. That's going to be one of our big pushes, and encourage team members and institutions to recognize SEMP as EM pharmacy authoritative voice. Again, this is going to be something that we're going to be pushing, and it's going to be a landslide. This is going to be something that's going to be amazing, and it's going to be talked about for quite a while. And I don't want people to miss their moment. I believe this is the moment. And this is a moment for a lot of you guys who've been out here, who've been supporting, but they really didn't feel that there was something that was really for them. This is going to be that. If you are an EM pharmacist, or even if you're not an EM pharmacist, every person who you know working in EM should know about this society and should know about the mission that we have to promote the growth of the individual pharmacists that work in these places and give the help that we need and provide the resources that we need. There's a ton of things that we're going to be working on, and we're going to be hyper-focused right now on building the system, the foundation, really building what we need so this can survive. And we have a ton of great people on our advisory board, because you guys probably see me and say, how does Jimmy do this? I have people that have been presidents in large organizations and founded large organizations that you're part of, that's part of our advisory board. I think when I calculated the number, it was probably over 200 years of EM pharmacy and just pharmacy leadership experience across the board. And some of our consultants have been working great with us to be able to guide us, because again, we really wanted to design the society to be clinician driven, but we don't want to minimize the benefit of having some of the business people on the back end. We don't want to minimize having some of the pharmacy administrators on the back end, helping guide us and push us in the right direction and being our voice of reasoning as we're designing these things. And that's been a great process to be part of. it's been eye-opening, to be honest, to understand, hey, have you guys thought about this? Have you guys thought about ensuring that this is already set up? Every little piece of the puzzle over the last few years, we've been really working hard to make happen and do it in a way that truly benefits you guys, that truly benefits the profession. And as all these things are happening around us, we're going to need a group of people to focus solely on our practice to make sure that this growth that we've just seen can maintain and not see this this huge surge of people exiting the profession. There's a few other large projects that I'm going to be launching at the end of the year that's going to help with some of that. But this is going to be the foundation of everything that we do. This is going to be my major focus for quite a while. So if you see me not having as many podcasts, you see me not doing as many of those other things, this is my focus now, guys. This is what I'm be focusing on. And I have a team of about 4 or 5 people who every day wake up to focus on the growth of emergency medicine pharmacists exclusively, full-time. That's their job. And we're super excited about that. So I don't want to make this too long. Again, I just want to emphasize this is going to be a transformative potential, and I don't want you guys to miss out. I don't want you guys to look back in a couple of years and say, I could have been part of something special and I didn't do it. It's going to be great. It's going to be really focused on, I founded this and we built this together because our specialty needed this. But more importantly, our profession deserved more. We deserve more than a few presentations at a large 4 or 5 day conference. We deserve more than just a simple recognition or one meeting here or there. We deserve more than promises of certain things and it not panning out, and we don't have the power to actually change any of those things. I've always been focused on collaborate with everyone, but if we don't have to, answer to no one. And that's been a big thing for me, for the group. And I'm just super excited to have the individuals around me that we've had, again, being a voice of reason. And I really want you guys to focus on how can you be involved in this and how can I look back in 10, 15 years and say I've done some phenomenal things. So I'll be putting more information out there, definitely on the society side. I'm super excited for this, guys. And I'm going to close out the same way I close out every episode, guys. Working at ED, you gotta be a pharmacist, but everything you do, make sure you farm so hard.
Closes it. Ozzy scratches his head. Whatever she's looking for, it isn't in there.
Perfect.